He's neurosurgeon working in Virginia. He died recently, and he worked a lot on blood-brain barrier and brain edema. So this was the first award the Japanese Society of Brain Edema constituted, and we had the honor to receive the first time. Then this is one of our students working on the same compound in cerebralizing in spinal cord injury in Uppsala University. So here the idea I told you that injury alone is one thing. When it is intoxicated with different kinds of nanoparticles, either in the air or engineered at workplace, it can enhance the injury potential. So this is one example. This is leakage of albumin in the spinal cord, and you can see that this is the normal situations here, and these are silver and copper intoxication. So the spread of albumin leakage is much more if the animals are given nanoparticles before injury. The same thing you can see here. After nanoparticles, you can see that the injury is much more prevalent in all these three cases compared to the untreated, normal animals after injury. So what will happen then? If these nanoparticle intoxication enhance injury, we should not give the same dose of the drug. They can help. So either we have to double them or give them through nanowire. So this is an example here. This is normal situations, and you can see that silver added the damage to the neurons, and leakage of albumin is much more higher. Here we have given cerebrolizin in this situation. It was able to reduce. But when we have given nanowire cerebrolizin in these situations, we have the best result, even they were intoxicated with silver or copper. So we can always think that we have to enhance our knowledge, but at the end we need to do more. These are some examples morphologically, that this is the leakage of blood-spinal cord barrier with lanthanum. This is very small ion. It has the molecular diameter of 18 angstrom. It is leaking under injury situations, but in drug situations, you see, when they are neuroprotection, they are not leaking into the endothelial cells. Here the tight junctions are also closed. Some examples briefly. We have measured mean negative potential on the rostral side. Normal situations, the high voltage. After a spinal cord injury, it is completely gone. And when we have given nanowire cerebrolizin, you can see it is able to protect the loss of negative amplitude. But things are not always there. This is the latency in normal situation that is increased after spinal cord injury. But this nanowire cerebrolizin was not able to reduce the latency significantly. This is after 5 hours. So we have to think about that. Okay. These are some of the examples of expression of gene expression, like CFOS expression. The cerebrolizin was able to reduce it. This is untreated. This is C-Jun. You can see that cerebrolizin treatment reduced the expression of C-Jun after spinal cord injury. And here is the example of blood spinal cord barrier leakage to iodine in T9 and T12. The result is that nanowire cerebrolizin was able to reduce it, whereas the normal situations did not. This was 5 milliliter per kilogram. And these are again examples that when there is neuroprotection, there is no leakage in the endothelial cells. You have so much leakage there. Edema went also the same way. Cerebrolizin nanowire was able to reduce it. And these are the examples of myelin vesiculation untreated. This is treated with another drug, endomethacin here, but you see cerebrolizin is much better than this drug given alone. This is the prostaglandin synthesis inhibitor. What could be the possible mechanisms of cerebrolizin-induced neuroprotection? One example that it produces probably reduction in cellular stress, and this is heat shock protein expression after 5-hour injury, and you can see this is the example. So that if the cellular stress signals are less, probably the neurons or glial cells are less active. We have the honor to have good support of former Premier Minister of Sweden, Honorable Göran Persson. He supports our finding. And also in China, you see, you might be knowing this is Dr. Li Ming, this is Dr. Wang, and this is Dr. Sandberg, who is editor-in-chief of cell transplantation. We all are working together on this aspect. We have good support from various organizations, and especially Wright Patterson Air Force Base and A1 Europe Pharma, Swedish Strategic Research Foundation, and also this from CGI1 hospital supports us, and all other organizations. Different collaborators, I will not name them, it's a long list, different places. So I stop here to take some questions for the first part. Questions from the audience? Don't be shy, just ask, yes.
Thanks for your excellent lecture. Just as you have mentioned, I know you have done great research on the nano protection by using the nano well or some newer factors. And I want to know when we use the some materials of nano or biotech, whether it will bring the problem of immuno reaction and other problems.
Yes, this is a very good question. Whether you use small nanoparticles individually separated, or whether you use different kinds of nanowire or carbon nanotubes, they are also of different lengths. Carbon nanotubes could be in a micrometer, you know that. So it depends on the biological reaction. Some of the nanoparticles could be less adverse effect producing on the brain, some could be much more. Like silver, it produces much more adverse effect than copper. Aluminium is the least, and titanium is so far is least. Therefore we have used titanium nanowires. But also some people are using gold nanowires, and our laboratory has some results that is suggesting that gold is also not that innocuous that titanium at the moment. So different nanoparticles, different size, different age. That's what my wife had showed in the last year's Society for Neuroscience lecture, that age and size of nanoparticles affect the brain damage or neurotoxicity. So we have to consider the age of the animals, we have to consider the size of nanoparticles, and there are so many other factors. But some nanoparticles could be less damaging, some could be more damaging. But so far, theoretically, like drugs, if you use any drug, it has some adverse effect. It will also change the immune system, it will also change other physiological systems. So likewise, the different nanoparticles have also different effect, but what we choose is the least innocuous in our hand.
And recent years, we have done some research on the spinal cord injury and the nano materials.
Yes.
And we combine the spinal cord, combine the neural stem cells and the nano well. But we found that there was not a good adhesion between the neural stem cell and the nano well when we transport them to the spinal cord injury. So I want to know, do you have some good solutions to this problem?
It depends on which nanowires you are using and which kind of stem cells you are using and how you cultivate them and how you nano-level. Because there are literature, even in nature of nanotechnology, that stem cells leveled with nanowires can live longer and grow fast and have less cell death compared to the non-nanowire. So I think these are the technical things you have to work on. The material that you choose for nanowiring is very important.
Thank you.
Any other questions? Well, I suggest before I go continuously, maybe some other person speak and then I will come back again. That would be much better. What do you think?
OK，我们再休息，
Yeah.
我们再休息。